My name is Stephen McCarus. I'm a gynecologist at Florida Hospital Celebration Health in Orlando, Florida. As a gynecological surgeon, instruments are very important to me, and the Richard Wolf mini instruments are robust and strong. Like any trade, you're only as good as what tools you have. And I have found that the mini instrumentation, the surgical instruments that are 3.5 millimeters, they're strong, they're robust, they're durable, they're dependable, and they will allow us to move tissue and manage tissue without any hesitation. They really perform well. There are many ways to operate, and each surgeon uses their own approach and techniques, but really clinical outcomes is what's so important to all of us. And I have found with the mini instrumentation and the ability to use smaller laparoscopes, the ENDOCAM system allows me to use a 3.5 millimeter trocar through the umbilicus, and then the secondary ports are reduced. So with the reduction of intrusion through the abdominal wall, what's that really mean? That means that there's less likely for a complication, a vascular injury, a viscous injury, and also it means less complications, but to the patient what that really equates to is less post-op pain, better healing, quicker recovery. Every decision we make on instrumentation directly relates to patient outcomes. So we have to provide patients with all these options, and that has proven to be very successful in our practice. So whenever we can use mini instruments, we try to do that. We've been able to expand our service line, so now we've actually created through mini laparoscopy and mini instrumentation, we're able to do hysterectomies, myomectomies, appendectomies, treatment of adhesive disease. So we really have a broad range of offerings using mini instrumentation. We did a scar assessment study at the McCarus Surgical Specialist for Women in Orlando, and we took 200 patients that underwent hysterectomies. We educated them about all the surgical options. Then we picked the appropriate procedure and did a follow-up survey. What was so fascinating with the outcomes of the study that we did publish a couple years ago is 92% of women surveyed said that cosmesis was very important to them. The size of the incision, the location of the incision, and they really wanted reduced scarring. So mini laparoscopy is an option for all women of all sizes, for all procedures, and we continue to evaluate outcomes. And what we're finding with mini laparoscopy, patient satisfaction scores are higher, and HCAP scores, the evaluation of my practice and the experience, has improved using mini laparoscopy and mini instrumentation. So I think it's a win-win for not only the provider but also the patient.
Richard Wolf. Spirit of excellence.